So at this point, we know a few things about breast cancer disparity in this country, and one of those things is limited English proficiency, or LEP. Patients with LEP, with abnormal mammograms, for example, present later and with more advanced stage disease than patients that speak English. Let's say they eventually do get their surgery. Well, the next step for 90% of patients is radiation, which improves local regional control. When the patient comes to the radiation team, the first thing that first time we'll see them is at consultation, and we might ask them something like, well, how much English do you know? Turns out, this is a point of confusion because what does the amount of English you know have to do with the type of care you can receive? Well, it turns out patients with LEP with left breast cancer may be ineligible for a radiation technique known as deep inspiration breath hold, or DIBH. In DIBH, patient takes a deep breath, deep inspiration, and holds it, breath hold. And in that time, part of that day's dose is delivered. In order to do this, the patient must be able to understand their therapist with instructions such as take a deep breath, a little bit more, hold it, and exhale. And this is important because as you can see in the CTs, the heart lies deep to the left breast. And compared to free breathing in DIBH, there's less heart exposed to the radiation, and therefore decreased mean heart dose. For every 1 gray of mean heart dose reduced to the radiation dose to the heart, there is a 7% relative risk reduction in ischemic heart disease. Over the summer, I looked at the last 33 months of patients presenting with left breast cancer at Maimonides and found that for 2 out of 3 patients, they don't get DIBH. This could be for multiple of reasons, such as physically unable to hold their breath, as well as sometimes DIBH is not that helpful. However, for 1 in 3 patients, it may be because they needed a translator at consultation. We hope to target this population by looking at, by testing the feasibility of pre-recorded, pre-translated DIBH instructions for patients with left breast cancer. And we know that Brooklyn's an incredibly diverse borough. We speak over 200 languages. 40% of us were born in this country. And so we want to test the feasibility of this, and to do this, we're going to first note the English instructions necessary to carry out DIBH. And then for each of the 4 most commonly spoken languages of Mandarin, Russian, Cantonese, and Spanish, we'll have a professional translate them, have a native speaker speak them, and then store these audio recordings into a soundboard iPad app so that with the push of the button, the therapist is able to deliver DIBH instructions to patients with limited English proficiency, and we can make a dent in this disparity in breast cancer care. Thank you.